We will talk about principal steps of genetic counseling. We will talk about ethical principles in performing genetic counseling. We will talk about how to understand the unique feature of genetic counseling in community, and we will talk about the pedigree and how to draw a pedigree. What is genetic counseling? Do you know anything about genetic counseling? That's right. Does anybody know anything about genetic counseling?
For example, when someone is a relative to want to get married, and should
Okay.
have brought some genetic disorder, and somehow they have more chance to have a baby with some
Right.
genetic disorder. You can talk about that.
Okay. Actually, as she said, genetic counseling is a communication process. Consultant and counselor are two individuals that participate in genetic counseling. Maybe somebody is seeking for some problem they have in their family, and they want to know either they can marry each other, or if they already married, they can have unhealthy actually offsprings or not.
And it's really important for relatives marriage.
Sorry?
It's important for relatives marriage. So for example, if cousins are getting married, it's
Yeah,
more important.
one important item in genetic counseling is consanguinity. It means marriage between the blood relatives. But it's not just limited to consanguinity. Maybe some unrelated people who marry each other, they have problem in their family. So they want to know if they want to have another child, what's the risk of having another child which is affected or is healthy, or even for some disorder, somebody wants to know he or she will be affected in future or not. Okay, and what's the chance of transmission of this disease to his or her offsprings? Okay. So we have, as I said, we have two actually key individuals in the genetic counseling. One is consultant, individual who seeks genetic counseling, and counselor, individual who gives actually genetic counseling. To prevent genetic disorders, we have the first actually part is genetic counseling and genetic screening or genetic test, treatment of genetic disorders, and education. For genetic counseling, we have genetic counseling in different people, in different age of the people. For example, in adult genetic counseling, premarital genetic counseling, preconception genetic counseling, prenatal genetic counseling, and neonatal genetic counseling. Also for genetic screening, we have some genetic tests, something like PGD or pre-implantation genetic diagnosis, PND, prenatal diagnosis, and neonatal or newborn screening, pre-symptomatic, conformational genetic test, and carrier testing. For adult genetic counseling, the reason that some adult individual came for genetic counseling is mental retardation in the family, or history of hereditary cancers in the family, history of known genetic conditions, blindness and deafness, development or degenerative disorders, and if they have pregnancy planning. For prenatal genetic counseling, the reason to refer an individual for prenatal genetic counseling, the first one is mother age, age of 34 or more than 34 years old, abnormal prenatal screening. You know, there are some prenatal screening tests for actually some women who are pregnant. If this test is abnormal, maybe they refer for genetic counseling. If there is genetic disorders, birth defect or chromosomal abnormality in the family, if a pregnant woman exposed to some known teratogen, if mother has some special medical condition like diabetes, like hypertension, maybe they need to have genetic counseling. If there are more than two pregnancy losses, parents are blood relative, and if they are from ethnic background, specific ethnic background, which maybe they are high risk for some genetic disorders. For pediatric or newborn genetic counseling, the reason for genetic counseling is abnormal newborn screening, child with one or more birth defects, abnormal growth, mental retardation or developmental delay, blindness or deafness, known or suspected genetic condition or genetic disorders, or family history of some genetic disorder. What happened in genetic counseling sessions? The first thing we need to do is gathering some information from the family. Okay. Sometimes we are actually facing with some genetic disorders, which is, this genetic disorder is not familiar for us. So we need to investigate about the problem. It's a new problem that we already actually don't have enough information for that problem. So we need to investigate about that problem. Then we need to evaluate the family, interpreting the information about the disorder, medical and family history, result of actually physical examination and test. Then we analyze this information to find out the pattern of inheritance, what kind of the pattern of inheritance is in this disorder in the family, and what is the recurrent risk. Then we share this information about the condition with the actual counselor or consultant, and then we talk about available options. If there is available option, we discuss about the available options. For example, termination of the pregnancy or more genetic tests, or if there is any supportive elements in the community, like some specific clinics or support group or some brochures, we actually support the family with providing this information, and then follow up the family. It means we need to have more than one session for genetic counseling. Maybe we need to gather some information and then share with the family in another actually session. For genetic counseling, there are some components that important things are. The first thing is taking the family history and pedigree construction. Maybe we need to have some clinical examination at genetic counseling session, and we may need to have some tests, clinical exam, radiology, biochemical, genetic test, and other tests that we may need to have to confirm the diagnosis, and also calculation the risk, recurrent risk, and then talk about the available option and to follow up that family. We usually say genetic counseling is a supportive actually non-directive and non-judgmental. What does they mean? Non-directive and non-judgmental. What does non-directive or non-judgmental mean?
Not directing them towards a specific option. You just leave the
Just
options to
giving
them.
them the option of deciding.
Okay.
Yes.
Make them feel free to say anything they want.
And
Right.
non-judgmental is not judging them for their decision. Whatever they decide, you'll be.
Okay. Yeah. Non-directive means we do not need, we must not we must not direct the family to a specific option. Okay. We just need to talk about available option, and then they decide by themselves what to do. For example, if a woman is pregnant and we did genetic counseling and we find out the fetus is affected, okay? We must not say, okay, you must do abortion, okay? The best option is abortion, okay? So we just need to talk about if you want to have abortion, you can have. If you want to keep the fetus, you can keep the fetus. But if you keep the fetus, you will have what's the consequence of this keeping? And then they decide by themselves what to do. Okay. And what about the non-judgmental?
Without judging their decision. Like if they go for abortion, you should not judge them for
Okay.
or discourage.
Right? Whatever they decide, we must not say this is a good decision or this is a bad decision. Okay? They decide by themselves and based on their own personal, cultural, and ethical and social actually background. Whatever they decide, then we do not judge them. This is a good or this is a bad decision. Okay? And the one important thing is we should emphasize that there is nothing that they have done for this situation. They have sometimes some people may feel guilty. Okay, they think maybe we did something wrong and this problem happened for us because of this. Okay, so we need to emphasize that they do not did anything which this problem happened for the family. What about the response to the counseling, to genetic counseling? What do you expect to from the individual who came for genetic counseling? What do you expect about the result of the counseling?
Some emotional reaction. For example, we say that we should get an abortion and angry.
No, my question is not this. I mean, do you expect that all families have the same reaction or the same response to the genetic counseling? All of depend on
each family.
depend on actually.
Different individuals, like it is their choice. Whatever they think is will be different from the other one.
Yeah, based on their culture,
How they take the information, how they understand it and process it.
based on understanding, based on the culture,
Religion and culture.
the religion, and they believe,
Their emotional state.
emotional state, cultural background, ethical, religion, and how they understand the problem. Based on this, maybe the response to genetic counseling will be different in different individuals. We cannot expect that all individuals will have the same response to the genetic counseling. Okay? You know, in medical field, if you face with a disease, you just have some clinical exam, some tests, and then you make a diagnosis and make a plan for the treatment. Okay? This plan may be surgery, maybe drug, maybe some other plans for the treatment of that actually individual. But in genetic, in addition to the patient, we also need to know about the disease, how the disease is transmitted, what is the pattern of inheritance, okay? We also need to know about the entire family, about the brother, sister, father, mother, cousins, if there is any affected individual in the family members, we need to know about them and we need to have information of for that actually other family members. So in medicine, if you just treat a patient, but in medical genetics, we need to know about the patient, we need to know about the disease, and we need to know about the entire family members. The first thing is in genetic counseling to take actually a family history, and we can use the family history in genetic counseling as a tool for diagnosis, for determining the test what kind of test we need to consider for this individual based on the family history, and to have a prognosis of the disease. We can actually identify other family members who are at risk for this genetic condition to prevent actually this disease transmit to other family members. And also family history helps us to exclude genetic disease. Maybe some condition at the beginning we think that this is a genetic counseling, then they need to do genetic test. But after the family history, after the medical history, find out no, this is not a genetic disorder, so they do not need to do any genetic test. Okay. To take a family history, we need to take the history which are relevant to present illness. We need to know about the early onset and preventable illness, and we need to know about the first degree relatives, and we need to ask about informative relatives in the family, and we need to know about the ethnic and ancestral background, because some genetic disorders are common in some special ethnics, and we need to know about the consanguinity, marriage between the blood relative, and we need to keep it up to date. What does it mean? Can anybody explain about what does mean keeping the family history up to date?
Making sure everything is covered. We don't miss out on anything.
Timely history taking.
What?
We take the history timely, like every other year or every 6 months. We need
A timeline.
Why?
Maybe a newborn in the family
Right.
will be, and he's affected.
Maybe after a few months or a few years, some people will be diagnosed as the affected individual, and maybe they have newborn or they have new child who is affected. Maybe somebody is died because of the disorders. So we need to keep this information up to date to make a decision about the family. We need to have information or family history in at least 3 generations. Okay, not just father, mother, and children. At least for 3 generations, we need to know about the name of each individual, and age of each individual in the family history. We need to know about the ethnic and racial background. We need to know about the health status, which individual is affected, which individual is not affected. We need to know about the age of death and cause of death, and also we need to know about the pregnancy outcomes. When we take the family history, then we find out that some families are high-risk families. If they have multiple affected individuals in the family, if they have some disorders like cancer, which is more common than usual, if they are from a specific ethnicity, if they are blood relatives, if they have some birth defect, mental retardation, developmental delay, and if they have unusual features, we find out that this family is high risk. If they have some genetic or chromosomal abnormality, if they have blindness, deafness, neuromuscular disorders, metabolic disorders, some problem with reproductive system, unusual common disorders, for example, hypertension or diabetes is common in all in the population. But in some specific families, maybe this is more common than other family members. If there are sudden deaths or premature sudden deaths in healthy individual in the family. After that, we go to draw a pedigree. What is the pedigree?
The family trees that we do to indicate who's affected, who's not affected. That starts with the family, with the parents, grandparents, the first generation, second generation.
Yeah, actually it's a chart. Okay, we use some symbols to actually identify each individual by these symbols, and we need some lines to find out the relationship between individuals. Who is the father, who is the mother, who is the aunt, who is the uncle, who is brother, who is sister. And then just by looking at these symbols, we can take all information that we need to know about a family. Okay, just using these symbols. The symbol that we use in the pedigree, we must identify by these symbols the sex of each individual, male or female, affectedness, if they are healthy or they are affected, and we need to identify the relationship between each individual in this chart. Yeah. And we use this pedigree or family history as a tool, as I said, for diagnosis, and we can find out whether the disease is genetic disorders, how the disease is transmitted, what's the pattern of inheritance, and then we can calculate the risk for each individual. Either this individual is healthy, is carrier, or affected. As I said, we can determine the mode of inheritance: autosomal dominant, autosomal recessive, partial dominant, sex-linked, mitochondrial, or maternal effect, and also the probability of each individual to be affected or to have an affected. You know, to calculate the risk, we usually use the Mendel law. You know about the Mendel laws, okay? But the problem in human is a little, the calculating the risk in human is a little bit different from what Mendel has been done many years ago. Because he actually crossed the peoplant, but in human we cannot have a cross between individuals, okay? We cannot use this individual marry with other one, this individual marry with other one, and then find out the result of this actually marriage. So based on what we have, we can draw a pedigree, and then to identify the pattern of inheritance, and then to calculate the risk and to identify which individual what's the possibility of this each individual to be carrier, to be affected, or to be healthy. The symbol that we use in pedigree analysis is something like this. Do you know about them? Do you know anything about this symbol?
Square for male, circle for female, diagonal for the infant or male.
Okay, justice.
Colored affected, not colored
Healthy.
normal, healthy.
Okay,
The horizontal line means married.
okay,
A vertical son or daughter. And of course it can be siblings also. The horizontal line.
okay. Any more? That's all?
Yes, I read once how like they're not completely affected. They carry the disease, but they're not affected by it, right?
Right.
Yes, colored is affected.
No, like
Yeah,
semi.
he said.
And not colored is not
Yeah.
affected.
Okay, he said also.
That's open.
Okay. The first thing, as we said, the first thing we need to identify in the
Crossed is dead. Crossed individuals is dead individual.
is
Dead.
that, yeah. The first thing we need to identify is about each individual, okay? And for each individual, we need to identify the sex. Male, female, and unknown sex. What's unknown sex?
They have
They have both genitals.
Not just that one, fetus. We do not know about their sex, okay? So, and also we need to identify this individual is healthy or affected, okay? So, healthy male, affected male. Healthy female, affected female. Healthy unknown sex, affected unknown sex, okay? If we are talking about two or more conditions, we divide these symbols to two parts or three parts or four parts. Then each part is for one condition. For example, if we are taking the family history for blindness and deafness in a family, okay? We divide each individual or each symbol for each individual in two parts, okay? The first part, for example, the left side is for blindness and the right side is for deafness. It means this individual is blind, but he is not deaf, okay? If we talk about three conditions, then divide these symbols to three parts. Each part belongs to one condition. If he is healthy, it will not be color. If he is affected, he or she is affected, then that part will be full. And if we talk about four conditions, divide to four parts. Okay. What is this?
Multiple individuals, multiple people,
Multiple individual who have the same condition. Okay. To make the pedigree short or to make a small pedigree small, a group of people with the same phenotype. If we have, for example, 5 healthy male, 5 healthy female, 5, we don't draw 4 or 5 actually symbols for 5 males. Okay, we just draw a symbol for male and then write down the number of individual inside the symbol. If you do not know about the number of healthy individuals, you just write down the N inside each symbol. If we have deceased individual, we draw this one on each symbol. If we have stillbirths, we write down stillbirths at the, for example, 28 weeks of pregnancy. If there are pregnant, then we find out, we write down actually the P inside there, inside this symbol. What is this P mean here? Probability.
Probability to have the
Proband.
So what does it mean?
This is my question. Maybe in a family there are some affected individuals that family actually came to genetic office because of that affected individual that they have in their family. So it means proband. The reason of actually genetic counseling in this family is having an affected individual. This affected individual, this affected male, this affected female. Okay, the reason for genetic counseling.
Can you explain it more?
So,
Can you give example?
for example, I go to genetic office. I have an affected brother. Okay, when they want to draw the pedigree for my family, they put this actually something like flash. The reason of genetic counseling is my brother who is affected. Okay, is the proband of this family. If there are, maybe there are more affected also, but there's only just one individual identify as a proband. Maybe for example, my brother is affected, but he didn't came to the genetic counseling. Okay, I actually went for the genetic counseling. I am as a consultant, healthy individual who came for genetic counseling. Okay. If we have a spontaneous abortion, we draw a triangle. If we know about the sex, we write down the sex. Spontaneous abortion, who is male, who is female, who is unknown sex. If we have affected spontaneous abortion, we fill it out and male, female. And if we have termination of pregnancy, male and female. And
Can we have a break?
sorry?
Can we have a break?
Okay. Just finishing this slide. Okay, after this slide. The second part is the identify the relationship between each individual. Okay. Mating between this male and this female. We draw a line between two individuals and connect them to each other. If divorce happen, then we draw two actually slash on there. If there is consanguinity marriage, we draw two lines to connect two individuals. Biological parents, father, mother, and boy, they are healthy. If we do not know about the biological parent, we just a question mark here. if we know about the zygosity, monozygote twins, there is a line between them, and dizygote twins, if we do not know about the zygosity, we just put a question mark here. If they do not have, if the actually parent do not have any child, or this couple actually doesn't have any child, we draw something like this. And if they have problem with pregnancy, this maybe this couple, they do not want to have any child, so they do not have any child. But this couple, they have a problem with pregnancy, so we draw something like this. And if there are or there is assisted reproductive scenarios, a sperm donation, male, female. This male has problem with sperm. They cannot have actually child, and they use sperm donation from another male, egg from the female, and then the pregnancy happened because of this sperm donation. If there is ovum donation, actually ovum is from another female, sperm is from this male, and the pregnancy happened based on this ovum donation. If there is surrogate mother, sperm is from actually this individual, ovum is from this individual, but the fetus has been grown in uterus of another female. We call them as surrogate. And if there is surrogate ovum donation and actually ovum donation, surrogate and ovum donation, it means ovum is from another female, and the fetus is grown is the uterus of another female, and the sperm is from just this individual. And to finish this actually pedigree analysis, this is actually pedigree from a family. When we draw a pedigree, the first thing we need to identify is the number of generation in the left side. Generation 1, 2, 3, and 4. And then numbering each individual in each generation from left to right. Okay? 1, 2. 1, generation 2, 1, 2, 3, 4, 5. Generation 3, 1, 2, 3, 4, 5, 6. And generation 4, just one individual. The affected status of each individual, this individual is affected, this individual is affected also. And when we draw a pedigree, when we want to talk about an individual in the pedigree, we just address each individual in the pedigree. How do we address?
By the number of the generation.
The number of generation and the number of individual in each generation. What's that address for this individual?
3, 4.
3, 4.
Yes.
Then we look at the pedigree and we find out that 3, 4 is an affected male. Okay? If we want to address this individual, we say
3, 6.
3, 6. Then we look at the pedigree and we find out that 3, 6 is an affected individual, and other more information. If we need, maybe we can write down that information. Okay? We can have a 5 minutes break, please.